Hi, I'm Steve McPhail, the Director of OET Online. And today, we're going to talk about writing a medical referral letter. So, how should you approach a medical referral letter? The key element to a well-written referral letter is planning. Good planning will help you to understand the case notes and respond to the task correctly. It will help you to organize your letter in a well-structured manner. So what questions should you ask in the planning stage? Well, firstly, and most importantly, who are you writing to? That's really going to help you determine what to include and what to leave out. Obviously, the kind of information that you include if you were writing to, for example, a physiotherapist would be quite different if you were writing to a dietitian. So always base it on who you're writing to. The second thing you need to know is the purpose of your letter and the reason for writing. If you're unsure about why you're writing that letter, then it's going to result in a letter that lacks focus. But if you can really understand exactly what the main issues are in the letter or the main problems, then that will enable you to write a letter with a good focus. Consider again who you're writing to, what information do they need to know, and what information do they not need to know, and what is the patient's current condition. Because the case notes are often quite long. You may have 2 pages of case notes, and you have to condense that down into a letter approximately 180 to 200 words in length. So really a referral letter is an overview of the patient's health, and information that is not relevant or not required by the health professional you're referring to can either be summarized or omitted. Ask yourself if the communication is urgent or not. If it's urgent, make sure you state it, but if it's not urgent, then there's no need to state that it is urgent. Are there any significant social factors which need to be mentioned? Now, social factors don't have to be mentioned in all cases, but they should be mentioned if they have some sort of impact in the ongoing care or to the person that you're writing to. Ask yourself which information you're going to paraphrase, and also which information can be summarized into your own words. You'll need to do both when writing a referral letter. Today, we're going to have a look at a set of case notes for a patient whose name is Ashley Kim. We have a date in the top left-hand corner, and we can see the patient's name and date of birth. Now, before reading through the history, we really should know who we're writing to, because that's going to guide us to what's important. So on exam day, always go straight to your writing task, because that is going to guide you as to which information you'll consider important and which not. So let's read it. You are a health professional working at the Brisbane Spirit Hospital, Burn Ward. Using the information provided, write a referral letter to the Director of the Women's Shelter, Harmony Home, 12 West Street, Northbridge, Queensland, 4543. Explain the reason for the referral, the condition of the patient, and subsequent arrangement for Ashley and her son. So at this stage, we don't know what this patient's chief complaint is, but we do know that we're writing to a director of a women's shelter. So a women's shelter, so that means the patient requires some sort of shelter. We need to find out why. Is this person a health professional? Well, perhaps not. They don't have a title of doctor or nurse here or some other profession. So that's a bit of a clue as to what we're going to include. All right, let's go back to the beginning now and find out about this patient. Now, as we read through the case notes, we need to decide what information is important, what information can be left out, and what information that we may include, we'll call this optional. So we've got a tick if it's important, We'll use a cross if it's not important, and we'll use an O for optional. Let's have a look through this case notes to begin with. We've got a date at the top, patient's name, Ashley Kim, and a date of birth. So let's find out about Ashley Kim's situation. Social history. She lives with her boyfriend, Brad Park, and their biological son in a one-bedroom rental flat. Employment status, Ashley, part-time waitress in a Korean restaurant. Brad, unemployed for 18 months, a binge drinker. Patient's parents live in Seoul, South Korea. Son, Alex Park, 5 years old, single child, attends the childcare centre when Ashley works. Right, so we know their background. And we look at the medical history, good past health, no known allergies, and now we have a date, the 10th of August 2017. Always compare that date with the date at the top of the letter. In this case, it's February 2018. So that's about 6 months ago. So you start to get the timeline clear. So the first presentation was 6 months ago. They attended the emergency department with bruises over left face, right eye, and forehead. They were examined by the triage nurse at the triage station. Got a question mark, that means possible domestic abuse. Vital signs, stable. There's an emotional report. Patient has been weeping and some sort of avoidance is going on. Patient claimed fell off from stairs, denied being assaulted by others. Assessed by the medical officer, and there was an X-ray of the skull with no fractures seen. There was no active bleeding. A cream was prescribed and they were referred to the clinical psychologist, in this case CP for short, for follow-up. The patient refuses the referral and discharges home. So that's the first visit, everyone. Let's continue. Okay, the second visit. So about 2 months later, again, attends the emergency department with son. There's an examination by the medical officer which revealed large bruises over the right upper quadrant at abdomen, corner of mouth, and right elbow. There was an ultrasound of the abdomen, no internal bleeding. However, a chest X-ray revealed a fracture to the left sixth rib. Son, crying and scared. Perhaps they attended by hospital volunteers or looked after by hospital volunteers. Domestic abuse. Suggested admission to rule out insidious bleeding of internal organ. Patient refused. So they refused that admission and they also denied the abuse by others or being abused by others. Patient insisted on discharging. 2 months later, so a bit of a trend, every 2 months here, on the 25th, so that's Christmas Day, attended the emergency department with son. Examination revealed burn marks over 4 limbs, possibly caused by cigarettes. Bruises over right face, bilateral eyes and forehead. There was a skull X-ray with no fracture, and the CT of the brain revealed mild contusion over the right frontal area, no bleeding. Suggested admission for further monitoring and referred to that clinical psychologist and a medical social worker. Then now we're getting close to today's date. So this is the 20th of February 2018. So there was a police case report. This is the current admission. Son was locked into the bedroom when the violence occurred. Brad forced Ashley to the ground, poured a pot of hot water on her. Ashley screamed and yelled for help. Brad pointed a knife towards Ashley, threatened to kill her if she called police. Son cried loudly. Neighbor was alarmed by the noises and called police, and the ambulance arrived. And Ashley was transferred to the emergency department and Brad was arrested by the police. Ashley was assessed. She had 10% burns over her lower limbs. Blood pressure was down and fluid resuscitation was started at that time, which would be yesterday. Then there's more medical details about her respiration. We can see airway patent, that's the medical terms. No obvious injuries, increased respiratory rate, possible pain. Then patient admitted to the burn ward for further management. All right, let's continue. Okay, so we continue on today's date, transferred to that burn ward, continued fluid resuscitation, morphine was given, commenced on prophylactic antibiotics. There was a wound swab taken and arranged for the, I think that's the operations theatre for surgical debridement. A wound nurse cleaned the wound and followed the burned wound management protocol before that operation room was ready. Son cared for by the Hospital Child Welfare Centre, referred to the clinical psychologist to identify possible post-traumatic stress disorder for Ashley and her son, and counselling and emotional support for domestic violence casualties. Ashley's general condition not fit for a statement, and the statement is pending. Right, so now we know the case, not a very pleasant case. Now, if we look at the task, we know that we are writing to the director of a women's shelter. So the obvious question is, why are we writing this letter? Well, I think it's pretty clear from what we've seen. What's the main issue? This patient has been a victim of domestic abuse. So that's going to be very important to include. So let's go through that in more detail, shall we? So planning. What questions are we going to ask? Well, who am I writing to? In this case, the director of a women's shelter. What is the purpose and reason for writing the letter? To request shelter for the patient due to a history of domestic violence. Now, it's very important. That's why you read the case notes carefully, because you need to know the exact reason for writing. And that information should go in your introduction. It shouldn't be buried somewhere in the body of the letter. It needs to be stated clearly right at the beginning so the person who's reading the letter understands what's going on straight away. What information do they need to know? Well, in this case, because they're requesting shelter and because of the situation, the social background would be important. Also, the history of abuse, how often it occurred, so that the case is clear. Importantly, the patient's current health should be mentioned, and also the involvement of other professionals in the care. What information does this director of the women's shelter not need to know? Well, there are a lot of medical details, as we just saw before, of the earlier admissions. That information, that medical information, should really be summarised and not included, because the director you're writing to is not going to act on that treatment. They're not going to take over the care. They're going to provide shelter. So you're really giving them the information they need of the case so they can provide shelter for Ashley and her son. What's the current condition? In any set of case notes, always pay special attention to the patient's current condition, because that will be important. You need to be able to express how the patient is on the day of discharge. In this case, they're in the recovery stage, recovering from burn injuries. Let's now write our letter. So we've got our task question, we know who we're writing to. And it always says here, expand on the relevant case notes into complete sentences. So that's your job. Don't use note form. We saw a lot of medical abbreviations in this letter and various acronyms. But when you write, you should really expand into full sentences and avoid too much note form. You've got to use the correct letter format, and the body of the letter should be approximately 180 to 200 words. What is the body of the letter? Well, generally speaking, it's below the salutation, starting with the introduction, but it does say body of the letter. So it doesn't necessarily include the conclusion, and also it's an approximate figure. So a lot of people are concerned about writing a long letter. Don't be too worried if you write a bit over, if the focus is good. However, I would avoid letters that are too short, because perhaps you're leaving out something important or there's not enough language to be assessed. All right, let's look at how we write our introduction. Normally we put the address above, but for this example, we're just going to start with the salutation. Dear Sir, Madam, because we're writing to a director and we don't know their gender. So we're going to put Dear Sir, Madam. All right, let's break down this letter into different sections. So we start writing our letter and pay attention to who we're writing to. We're writing to the director of the women's shelter, and we know they're at Harmony Home, and we've got the address. So probably the first thing I'd suggest on exam day is you put this information and the date, put the date at the top, then who you're writing to and the address. But for the purpose of this presentation, we're going to start with the salutation, Dear Sir, Madam. Now we could put Dear Director if we wanted to as well, but in this case we're going to put Dear Sir, Madam. We can't put Dear Madam because we don't know the gender, so Sir, Madam allows us to cover whether the director is a male or female. Then we're going to put patient's name, Ashley Kim, date of birth, 10th of February, 1993. Now, today's date we saw up the top was the 21st of Feb, 2018. So we can calculate by that this patient is 25. All right, so I'm writing to refer this patient. Now, this patient's very useful, this word, because it allows us to refer back to the subject line. So we don't have to repeat it. I'm writing to refer this patient, a 25-year-old Korean woman who is recovering from injuries following a domestic abuse incident. So it's a very short and concise introduction, but it's a very good introduction because we get a bit of background information. We also know the current state. They're recovering from injuries. We don't know the details yet, but we do know that it was following a domestic abuse incident. So straight away, that explains the need for shelter because of the domestic abuse. So it's a good summary sentence there. Okay, so we've written our introduction. Now let's write our first paragraph. A good place to start for this letter would be the social history so that the director of that shelter can know a little bit more about who their patient is. So we're going to summarize the social history that we read before. Let's look at how we do it. Ashley was living with her boyfriend, Brad Park, and their 5-year-old son, Alex Park. She was working as a part-time waitress, and Brad had been unemployed for 18 months and has a history of binge drinking. Alex was attending childcare when Ashley was working. So what we've done here, we've selected information, but I want to show you something. Look, we've got lives here, patient lives. So at the time it's true, patient lives. Why do you think we've written was living here? Well, the reason is because it's domestic abuse, we can ask ourselves, will Ashley go back to her old social situation? Probably not in this case. So we can use past tense because it's most likely that Ashley won't be returning to that 1-bedroom rental flat. She probably won't be returning to her part-time job, and her son Alex probably won't be going to the same childcare. There's probably going to be significant change. So that's the reason why past tense has been used here. But bear in mind, if you expected your patient to return home, perhaps they're returning home after admission, then you could use present tense. So really you have to think about the case in detail, think what's going to happen next, and that's going to guide you as to the way that you present that information. Always a lot of thought will go into this. In the letter, we've added some pronouns, her boyfriend, because that's admitted in the case notes because it's short form. The case notes say Ashley is a waitress, but here we put an article, a part-time waitress, because waitress is a countable noun, so we need to add our articles. Very important. Brad's unemployed for 18 months, but we've got to add the preposition for time, and he had been unemployed for 18 months. And we've also, he's a binge drinker, so this writer has used the formal expression, has a history of binge drinking. We use an article when we nominalize the noun, as in this case, a history of binge drinking. Okay, so that's our first paragraph done. Now let's look at our second paragraph, and we're going to write the patient's past medical history here. Now we saw before the patient attended on 3 different dates. So these were the 3 earlier admissions, and we've got to summarize this. We've got to try to condense this down because there's a lot of very important information. But it's, in this case, because we're not writing to a health professional, and because this is previous treatment, we can really use our summarizing skills here to really condense down this information. Because there's a lot of information here that, although it was very important at the time, is no longer important. Having said that, we do need to summarize what occurred in general terms and paint a bit of a picture of the incidents, which had occurred over the previous 6 months. So if we use our tick-cross method, I'll give you an example of how we can do this. So attended with bruises over the face. So that would be important, but we probably don't need to say the details, just the bruises. Examined by a triage nurse at triage station. Possible domestic abuse, that would seem to be important. Vital signs stable, not really relevant. Emotional weeping avoidance. Yeah, well, let's just call that O for optional. We may include that. Patient claimed fell off from stairs. Probably the details aren't necessary. There's this denial here. Maybe that's important. Denied being assaulted. Assessed by a medical officer. Not necessary. Skull x-ray, no fracture seen, so not really important. No active bleeding. Prescribed peridoid cream. No, it's more the medical side of things. Referred to clinical psychologist. Yeah, possible we'll mention this because of the trauma and the situation of the case, this may be relevant. Patient refuses the referral and discharges home. Oh, well, we'll just call this optional here. Let's continue. So on the second visit, attended with their son, examined with large bruises, so more bruising here. We might continue with that. There was an ultrasound, no internal bleeding, chest x-ray. Okay, this is the fracture we saw before, so another injury. Son crying and scared, yeah, maybe we want to include that. Accompanied by hospital volunteers doesn't seem relevant. Domestic abuse, well, there's that trend. Suggested mission to rule out insidious bleeding of internal organ. Sounds really bad, but we don't need to include it because it's what happened, 4 months ago. Patient refused. So again, we've got a trend of refusal here. So things are happening again and again. That would indicate they're significant and wanted to discharge home. Okay, then this final visit in December, attended again with son. This time we got another injury, burn marks over the 4 limbs, and it's optional to include the cause of the burn, but maybe the burns is enough. More bruising. There was a skull x-ray, but no fracture, and the CT of the brain revealed mild contusion over right frontal area, no bleeding. Yeah, I guess that is optional. Just remember though that we're not writing to a health professional. So that guides us as to what we include. Suggested admission, it says suggest because it uses present tense because that's what was written at the time. But we're looking at it from today's perspective. So that's past tense. Suggested admission for further monitoring and referred to that clinical psychologist and a medical social worker. Well, there's a bit of a trend here. They've been mentioned again. And again, the patient refused. All right, so how do we get all that information into a paragraph? Well, this is how you can do it. So since August 2017, so straight away we're referring back to this past date. Very good skill. We don't need to go, you know, August is close enough. It's 6 months ago, so we don't have to put the specific date. Since August 2017, Ashley has presented to the emergency department on 3 occasions. It's our 3 visits. On 3 occasions with a range of injuries, including bruising, fractures, and burns. So there it is, everyone. There is your summary sentence. That's how you can do it. All that information condensed into just 1 sentence. So that helps you write within the required word limit and allows you to not include all those non-relevant medical details. Note the tense. Since August 2017, Ashley has presented. There's our present perfect because it's from the past and up to now. And then a good use of a range of injuries to summarize, and then the verb including bruising, fractures, and burns. Appropriate medical treatment and care has been provided. So treatment and care, we've used that as a singular part of the treatment, so we can use a singular has. So treatment and care has been provided, using that as a collective noun each time. So just summarizing what you did without putting any detail. However, Ashley has refused psychological support. That's good summary skills. And also denied the possibility of domestic abuse. So we're really just taking words from the case notes. That's a real skill. Denied that abuse. Was mentioned a few times. And we've also used the word, this word refuses. So we've borrowed language from the case notes, but it's been put into an original sentence. So think about that when you are summarizing and paraphrasing. If the words in the case notes were appropriate at the time, you're allowed to use them. But always remember, you have to adjust your language and organize it into a well-structured sentence. That's your job, but you can take language from those case notes. So now we're up to the final visit, the 20th of February 2018. This is the police case report. So we've got a lot of information here. How are we going to get that into a letter? Well, this time around, let's look at the letter first, this paragraph number 3. So on this date, on the 20th of Feb 2018, a serious incident of domestic abuse occurred. So this writer's quite skilled. They've summarized it. How do we know it's serious? Well, Brad forced Ashley onto the ground, poured hot water on her. Ashley screamed. Brad pointed the knife and threatened to kill her. So very serious. So the nature of this event tells us it was a serious incident of domestic abuse occurred. So that's a good summary skill sentence. Due to which Ashley received significant burns to her lower limbs and her life was threatened. Now again, good language here using the verb receive because we can receive an injury, so showing off good vocabulary. There's a lot of information here about the burns. It said there was 10% burns to the bilateral lower limbs. But in this case, the writer simply said she received significant burns. So that's good summary vocabulary. Didn't use the language in the text, use original language because they are significant. Left out bilateral, just simply wrote lower limbs because that bilateral is a bit medical, doesn't really need to be included. Very importantly, Brad threatened to kill her, but we've changed the structure. This writer's written, her life was threatened. So focusing on her life and using the passive form. And obviously very significant, if someone's life is threatened, that should be stated. We now go to an active sentence. A neighbor called the police, all right? And again, this is just taking language, just shortening it. We don't have to say the neighbor was alarmed by the noises. When we summarize, we can just shorten it. A neighbor called the police. And then we've got Brad arrested. Notice how though the notes don't put the passive verb because you can just omit those be verbs when you're using note form. But when you write, you need to expand on it. So Brad Park was arrested. Then she, Ashley was transferred by ambulance. So another passive sentence. Again, the case notes leave out the be verb, but you need to include it. So she was transferred by ambulance to the emergency department and is currently being treated for her burn injury. So currently. Always a nice word so we know what's happening now. So that's a really good summary paragraph. Now, paragraph 4, and perhaps our final paragraph. And this is going to include the discharge plan. So again, let's just go straight to our letter and we'll see how the information has been selected. So her son is under the care of our hospital's child welfare centre. And really, that's just mentioned here. So we need to include what's happening to the son. Please note, they have also been referred to a clinical psychologist for possible post-traumatic stress disorder counselling and emotional support. And again, what we're doing here, we're not using the abbreviations and the acronyms, we're writing them in full. That's very important. Don't be lazy when you write. The task question says expand on the case notes, so you should really do that. Note the language here. They have also been referred to a clinical psychologist. So here it says refer to in the case notes, something to do, but when you write, you can say this is an action that you have done. So it's present perfect passive for a completed action with a result now, because this referral is still current. So you can use this language when writing your discharge. A nice polite conclusion. I would appreciate it if you could provide shelter. So there's nice original language. If you could provide shelter. Nice formal way of writing. And would and could are our polite verbs. So I would appreciate it if you could provide shelter for both Ashley and her son after discharge. So one thing you'll notice here, all of this, in this case, a lot of medical detail was included about what was done in the ward to treat this patient. Now, of course, if you were writing to a health professional who was going to continue this care, all this information would be very relevant. But in this case, it's not really the most important information. So we don't have to include it all, because really what's important is what's happening socially, what's happening to the son, what's happening to her emotional state, because those are the areas that the shelter are going to provide support in. So here's the letter in full. This is what it looks like. We've got our date there. We've got the director who we're writing to. We've put the address down here. Then the dear sir, madam, the Ashley Kim, the date of birth, and then we've got the letter. You can see it's 214 words. So that's basically, it says body of the letter. I suppose in this case, 214 includes everything to the conclusion, but in reality, this does fit in. Conclusions are quite general statements, not necessarily the body. I would consider the introduction part of the body because it has really important information, but a generic conclusion is generally not counted as part of the words. So this is well within word limit. We've got the closer here, yours sincerely, and it's just a general example task here, so health professional and the burn ward. So now, what grade would this letter be? Well, I would definitely say this is in the A range because there are no errors and it's well organized. It has a really good focus. So it's quite a well-written letter, very well planned. All right, let's just go through some of the main features of this letter. In the introduction, we included the patient's age, their gender and nationality, and we summarized the main issue. In paragraph 1, we really gave background information, the social history. So her relationships, current activities, and a little bit about the partner. Paragraph 2 summarized the first 3 visits. Paragraph 3 put the details of the most recent admission. And then paragraph 4 was the discharge requirements and what's going to happen next. What was omitted? Well, the patient's medical detail, because this was a referral to a non-medical professional. So, yep, a well-focused letter. And remember, though, that the content that you include very much depends on who you're writing to. If this letter was to a doctor or a GP, or if it was to a community nurse, obviously it would have a very different focus. So that's why don't go into the exam with some pre-planned idea. The most important thing you do is react to the task you're given. And in order to do that successfully, you need to plan the letter carefully and you need to understand the situation. The better you do that, then the better focus your letter is going to have. It's going to be, it will end up with an effective organization and structure, and that will be the key to getting a good result. Now, I'm going to show you something here which I think you'll find useful in your own planning when you're studying at home. It's the use of a mind map to help you write a well-organized and focused letter. This technique can be used regardless of your profession. The example we looked at today was a hospital environment, perhaps something a nurse or doctor might see. But regardless of what your profession is, you can apply the same strategies because a medical referral letter is the same for all professions in terms of its objectivity, in terms of its formality, and in terms of its general structure. It's just that the content changes based on, each profession. But this mind map can be applied to all professions. So make sure you know your reason for writing, very important to know that obviously, and put that in your introduction. Then you've got to decide what else are you going to put in your various paragraphs. The relevant medical history, social factors may or may not be included. You need to make that judgment based on the situation. In this case we saw today, it was very relevant, but in other cases, it may not be relevant. Another important factor is the progression. Always ask yourself, is the patient's condition improving? Or is it getting worse? Make sure you understand that. The treatment and medication, it might be very significant and needs to be included. The current condition and plan is always very important because it's the patient's current health. The next health professional is going to continue the care from that point on. So always focus your attention on the current condition, and probably the medical history will tend to be summarized. Well, I hope you found that helpful. Practice is the key. If you need more help, come and study with us at OET Online. You can see our website there. We've got some excellent study options for all professions. We've got live lectures so you can participate in this sort of activity like I've done today. and we've got tutors available who can correct and grade your writing and help you improve step by step. So see you at oetonline.net.au. Bye for now.